So, what do you do now with this empty space? You've just had a root canal tooth extracted. Maybe you've had 2 or 3 root canal teeth extracted. You can't eat as well as you used to with less teeth, so those teeth need to be replaced. There's lots of different ways that a dentist can replace a tooth. We can replace a tooth by putting a plastic tooth in its place. That's usually called a denture. It can be a full denture, which means all of the teeth in the arch are missing. It can be a partial denture, which means some of the teeth in the arch are missing. You can replace the tooth, a missing tooth, by making a bridge. Well, in order to have a bridge, you've got to have 2 sides holding the bridge. I like to talk about the New Jersey side and the New York side, since I'm from the Northeast. If you have the New Jersey side and the New York side, you can make a bridge, but you must have both. If you're missing one side, then you can't make a bridge. Then it has to be a partial denture. So now we've got 2 ways that you can replace a missing tooth. You can either replace it with a denture, full denture or a partial denture, or you can replace it with a bridge. Some people prefer to replace their missing tooth with an implant. An implant. 99% of the implants done in the United States now are made out of titanium. Remember we were talking before about things happening in the body at the microscopic level? At the microscopic level, you've got a white blood cell that's maybe 8 to 10 microns wide, swimming around in the bone marrow. When it sees an implant that is 10 millimeters long, it looks like the Titanic to them, maybe even bigger than the Titanic. Your body immediately recognizes this Titanic as not self. That's basically the job of white blood cells. They swim around the body examining what's self, what's not self, what's not self. And as soon as they see something that's not self, they set up their plan of attack to get rid of not self. So when you have a titanium implant, your immune system is on red alert 24 hours a day, 7 days a week, trying to figure out how to get rid of this titanium implant. I've said it before and I'll say it again, it's a free country. You can do what you like with your white blood cells. You can have your white blood cells spend all their time trying to figure out how to get rid of the Titanic, or you can have an implant removed, or not, better yet, not have one put in your mouth at all. It is your choice, but you need to understand having an implant, having anything inside the bone marrow is going to depress your immune system. Why do they get depressed? They get depressed because they're overworked and underpaid and never get a vacation, never get a day off. That causes a depressed immune system. And when something important comes down the pike, your immune system is not going to want to help you as much as you would like.